programme, which is a really, really exciting opportunity for a year-long paid placement in NHS finance for school leavers. I'll start by introducing me and telling you a little bit about me before I talk about the programme. Then we'll hear from one of our existing students on the programme, and then maybe if we've got time, we might have some time for questions at the end. So if you do have any questions as we're going, as I say, please put them in the chat and we can either respond to them in the chat or I can answer them if we have time at the end. So my name's Tom Shearer. I'm a Chief Finance Officer in the NHS and I work for an organisation called Central and North West London NHS Foundation Trust, which is an organisation that provides mental health and community services to people of North West London and beyond, as well as some other specialist services like healthcare in prisons and a few other more niche parts of healthcare. It's an organisation that employs 9,000 people and spends about £780 million every year. And as the Chief Finance Officer, what's a Chief Finance Officer in the NHS? So I guess my role consists of two big things, really. One, to make sure that the services that we provide get the funding that they need. So from Treasury, from the government, as it flows down through the NHS, to make sure that my organisation and our organisation gets the funding that it needs to provide the services to its population, which is obviously a huge challenge to the whole NHS at the moment, but also to ensure that that money is well spent and that the money that we are spending is used to the best value for our population and service users. That includes lots of other things like producing annual accounts, the annual report, and information for decision making, which is a large part of my job, to make sure that we're producing information that we can use for decision, as well as some other parts of my job around making sure we have buildings and enough money to provide IT and information for the whole organisation. And I guess first thing to say about my job is that I really, really enjoy it. I love it, and it gives me a really, really nice life. And that really is my motivation and was our motivation, my personal motivation for starting this programme. And I feel just incredibly privileged and lucky to do the job that I do. And I put a lot of that down to quite a lot of luck. I didn't get straight A's at school. I did okay, but not particularly well. Come from a single parent household, so lived with my mum and three sisters, and she worked a lot. She was a healthcare assistant at Addenbrooke's, and she worked a lot to make sure that we had a roof over our head, were fed and looked after, which didn't give a lot of time for thinking about what my long-term future was going to be. I was very, very lucky that I went to a college that encouraged me to attend university, and I had a fully funded place, so I didn't have to pay tuition, and got extra loans to support me. And as I said, my mum was a healthcare assistant in the NHS, so she got me a job, or helped me get a job at weekends while I was a student, which first introduced me to the NHS. And I'm very, very aware and conscious of the fact that a lot of people from low income backgrounds don't have the same luck that I had, might not have enough money to go to university, might not be aware of the NHS as a huge employer of many professions, not just doctors, nurses, physios. There's lots of other roles within the NHS as well. Or it might be that becoming an accountant just seems like something that isn't something that's possible. Some people have the view that it's mainly people from middle class backgrounds or people who go to university that become accountants, and that just is not the case. You don't need a degree to be an accountant. You don't need to be superb at maths. You need to have a basic understanding. But there's so many more skills that go into being an accountant and working in NHS finance than just the traditional ones that you might think of. So with all of that in mind, and the huge fortune that I feel I had through various points within my youth, we thought it would be a brilliant opportunity to to give us an opportunity to other people from lower socioeconomic backgrounds, so from low income households that are finishing school that don't see university as an option for them, to give them an opportunity to start their careers and gain some experience in NHS finance. So I'm going to take you through a few slides now to tell you a bit more about the programme. And then I'll play a video at the end of one of our existing students, so she can tell you a bit more directly about her experience. So stick with me a minute while I put the slides up. Right, Grace, I can't see or hear anything now. Can you see the slides, Grace?
Yeah, we can. It's not the first slide, but it's
fantastic.
Yeah, there you go.
Hopefully we're back now.
Yeah.
Right. So as we say, this is about growing future talent in the NHS and being able to attract a different kind of talent into our organisations. So why is the scheme important for the NHS? So we know that in NHS finance, our leadership teams don't reflect the wider diversity of our teams and of our wider population. So, for example, 23% of our finance staff come from BAME backgrounds, but only 8% of our directors are from that background. Research has also shown that people from disadvantaged backgrounds don't do as well as their better off peers. So only 25% of people that were eligible for free school meals and attended university, compared to 45% of their better off peers. And in the NHS, we have a graduate scheme. So we have a programme for people who are finishing university to come into the NHS and become managers or accountants or leaders of other kinds. But there's no similar opportunity for school leavers or people who don't have a degree. And you might ask why that's important. So for so many reasons, but two main ones or two big ones. So research has shown that more diverse leadership teams make for better organisations. So there's been some research that says that if you have a senior management team or a leadership team that are made up of people from lots of different backgrounds, decisions are generally better and more profitable. And within healthcare, that would translate to being better value. And everyone in our workplace should feel like they belong there. And it's very difficult for people to feel like that if they don't feel that themselves represented within leadership teams as well. So we know that within NHS finance, we have a big gap in terms of making sure our leadership teams and our departments are a reflection of our society. And therefore, if they are a reflection of our society, the better place to make decisions about our population. So the Insights programme is a 12-month paid placement in an entry-level finance-based role. And there are lots of different functions within finance. So some of it might be about registering invoices that an organisation receives, or about using some of that information that I spoke about earlier to help doctors, nurses, operational managers, other clinical staff understand the decisions that they're making and how they can best make decisions, not just with their patients, with the patients at the centre of everything, but also making sure those decisions are best value with taxpayers' money as well. The scheme does have some eligibility criteria, which I'll come on to talk about later, but there are placements available all over the country, which again, I'll talk a little bit about later. So the salary is an NHS Band 2 salary. So that's approximately £22,000 a year, or within central London, where there's a bit of a higher cost of living, that it's about 27,000 as well. We have 47 placements starting in September. And as I said, they start in September 2024. So who are we looking for? So for candidates to qualify, they must be attending state school or college, and have a grade C or 4 in new money, in GCSE maths. That is a desirable criteria, but not essential. If there are extenuating circumstances that mean that that's not been possible, we still want to receive your application. Must not be planning to attend university. And then either one of the following must be true. Either the occupation of your main household earner is categorised as a lower socio-economic background, or you've been eligible for free school meals at any point in the previous 6 years. Other than that, the thing that the type of candidate that we want to attract is simply someone who's got a desire to work in NHS finance, to learn new skills, to give value to healthcare, and to have a real interest for learning new skills, and being able to apply themselves within that work environment. No previous work experience is necessary, but any experience or evidence to show your dedication to working in this field will help as well on the application. I spoke about hosting organisations. I'm not going to read everyone out, but you can see here that we have organisations that are hosting in pretty much every part of the country. So we have 6 organisations in the northeast. We have 7 organisations across Yorkshire and the Humber, 1 based in Liverpool in the northwest. A huge amount of organisations throughout the Midlands, both covering East and West Midlands, 5 organisations in the east of England, and 2 in the southwest focused around the Bristol area, 4 in southeast, covering Kent and the surrounding areas, and then a number of placements as well across London, covering all different parts of London, so northeast, south and west. So the hope would be that wherever you are based, there'll be an organisation that is close enough for you to be able to be interested in and work within. So this is the second year of our programme. So we have had 5 young people as part of a pilot within London, working in London organisations, and they are coming to the end of the programme, and we are supporting them finding full-time substantive jobs within NHS finance at the moment. And it would be fair to say we've learned a lot through that programme, but the biggest thing that I've learned is that there's a huge amount of potential and a huge amount of potentially fantastic chief finance officers or accountants of the future within parts of our society that otherwise wouldn't have potentially seen this job opportunity as one that would be suitable for them. The way we've seen these young people grow and develop, learn new skills and become more and more confident as the programme progresses has been really, really exciting, and I'm really, really confident that they're going to come out into full-time jobs. And the year that they've been able to have on our Insights programme has helped them learn skills and build up and develop the confidence to go into a full-time substantive job within the NHS. So that's largely the programme. I'm now going to share a short video of one of our placement students at the moment, or at least I hope I'm going to, if I can get the technology working correctly. So as I say, we've had 5 young people on the programme at the moment. We're going to hear from one of them tomorrow. Grace, I'll look to you at the moment. Is that on the screen?
Yes,
Lovely.
it is.
Thank you very much. Here we go.
We can't hear it, Tom. It might be when you share that there needs to be sound. Do you want me to try from my screen?
Yes, please. That would be fab.
I will
Luckily,
try.
we had a plan B. See if our plan B works better than our plan A.
Can you see the video on screen?
Yes, we can.
Okay, I'll try play.
No, still no sound.
No sound?
No.
Okay, let's try this one more time. Include sound. I think this should work. Sorry about that.
Still no luck.
No sound?
No.
Okay, let me try one more time and let's see how that goes. It's saying
We'll
include
try
sound.
one more time before someone's mentioned in the chat. We will share a link for you guys to look at the questions in your own time.
Okay, I'll try this time.
No, still no luck. Not to worry. It's not a problem. And what we'll do is we'll share the link to the questions that Tamana's answered, just to give you a bit more of an insight as to what it's like being on the program and some of the experiences of our young people that have been through the program. So we'll make sure that you have access to that as well. I think what you will hear is Tamana speak about the kind of positive impact on her and how it's helped prepare her for the world of work, as well as giving her an opportunity that she otherwise wouldn't have been able to access without the programme. So the deadlines for the application are the 24th of May, and Grace will also share in the chat a link to our website, which also has a brochure, some more information about the programme, and perhaps most importantly, the application form for people to complete. So as I say, we've got until the 24th of May to submit your applications for the programme starting in September 2024. Some kind of tips for filling in the application. As I say, we are not looking for people who have experience or who have exceptional academic records. The questions on the application form look instead to test what your interests are, and what's your motivation for working in the NHS, and is this an opportunity that is going to work for you, but also for us as well, to make sure that you're able to provide value as well as get an experience that is of value to you. My hope and dream for the programme, as I say, we've had 5 starting in organisations in September, and we have 47 starting in September 2024, is that from the graduate scheme, there are lots of leaders and executives who have done the graduate scheme, who have come through the university, through the graduate scheme, and into jobs in the NHS. And I don't see why school leavers who don't see university as an option for them aren't equally well equipped through their personal skills and their desire to learn as anyone who's got a degree. So I hope that over the next 10, 15, 20 years, people coming through the Insights programme are coming into senior jobs within the NHS, are able to not only have a job and a lifestyle that that is exactly what they would want and what they're looking for. But in return, I know that if we have leadership from different backgrounds, the NHS will be in safer hands and better hands in 20 years' time than they are today, for the benefit of having young people from different backgrounds in leadership posts. And I'm young enough, hopefully, to still be working in the NHS when that happens. So that's my challenge to myself, is that by the time I retire, when I leave the NHS, there's 150 odd NHS organisations that all need a chief finance officer up and down the country, and I hope a number of those are filled with people who have come from our Insights programme and find themselves in leadership roles that they otherwise wouldn't have had. So that is all of the information. So what we'll do now is we'll go through some of the questions that are in the chat. and that's and see how many we can answer. If that's all you're able to join us for, then please do head to the website, look at the application form. And if you're thinking about whether this might be for you, apply. Because if you then get an interview, you can ask more questions at that point. And if nothing else, you'll have had the experience of having a real interview, which will stand you in good stead for the future, regardless. So our first question we have is, do you need to have the intention to go to uni to be accepted on this programme? To not go to university to be accepted on this programme? So the programme is designed for people who aren't intending to go to university. So it will start in September. So at the time university would start. So by definition, you can't do this scheme alongside going to university. So the ask is that you don't have the intention. After the end of this, towards the end of the programme, we will be supporting young people, the young people on the programme, into their first roles in the NHS. What I would say is, if through the programme, that as the year progresses, you decide that university actually is an option for you, that's totally fine. And you know, this program really is about supporting young people to get an experience that helps stand them in good stead. But what this program will be really good for is for people who aren't intending to go to university, because it will start them in work and also to support them to transition into their first role as well. Not guaranteed, it's a 1-year opportunity, but we will support you to get that substantive role. So if you are not sure, then still consider it. And it might be that by starting the programme and enjoying your placement so much that makes you decide to want to carry on working. But if throughout the programme you decide you want to go to university, fantastic. Whatever is right for you. Yes, we have sent the link, so hopefully you guys can watch it as well. Sorry about that. It shows that we're not IT specialists. Next time we'll be fine. Grace has shared the link for the brochure, which is fantastic, and the link for the application form is through that link as well. So the recruitment stage is after you've applied. Good question, and exciting to think that you are going to apply. So basically, the process after the application forms close is that we will shortlist candidates who have been able to convey in their application form that they're interested and committed and dedicated to a career in NHS finance. And then there will be an interview with a panel, and that interview will be based within the region that you are based and that you have flagged as your preference. And that interview will continue to explore the same things. So there'll be no questions, there'll be no maths questions, there'll be no questions about technical accounting. It will be testing your desire and commitment to work in the NHS. And it's from that interview that we will select successful candidates. So after the application, it is one maximum 30-minute interview, and then we will select successful people to join the scheme. What will our day-to-day activities look like? What a shame that we couldn't get the video working, because that was one of the questions that we asked Tamana. So throughout the year programme, we hope your day-to-day activities will be different. So we're asking for each placement to provide at least 2 different jobs. So maybe it could look like 6 months in one job, maybe as part of the contracting team, the team that deals with our contracts with other organisations, or maybe as part of our financial reporting team that looks at our annual accounts. And actually, in the first instance, what your day-to-day will look like is learning the basics of our systems. So a big thing that we use a lot in NHS Finance is Excel. So learning Excel skills that allow you to take lots of data that we have and present it in certain ways. There'll be some meetings, so either meetings with fellow people within the finance department, or out with services as well, with doctors and nurses or other healthcare professionals and managers who are making decisions. But one of the brilliant things about a job in the NHS is that it changes all the time, and the amount of variation that there is within each day is really part of the strength. The jobs will be office based. So you'll be based in an office. Lots of places now use hybrid working, which is where some days are in the office, some days are working from home. Um, and as I say, lots of it will be around meetings within the finance department, but also outside to help people understand the numbers. But as I say, lots of it is around Excel and other systems, being comfortable with data and presenting information in a way that's digestible for other people. So no 2 days the same. Office based with some home working as well, very likely. And working out likely with services and other providers as well. Is it all right to connect with you guys on LinkedIn? Absolutely, definitely. And as you search through LinkedIn, you'll see that we've got lots of information that we're sharing through LinkedIn. And we have they're called regional academies. So whichever part of the country you're in, our regions are leading the promotion of the scheme within their region. So for example, London is a region. And hopefully through LinkedIn, you'll be able to navigate and find our regional teams. And actually, it might be worth us sharing the One NHS Finance LinkedIn on this, so you've got a start as to where and to navigate through. But try and find your regional teams as well as people maybe from your local organisation that you could contact and say that you're interested in this as an opportunity. All of that research and trying to get bits of information from other people will stand you in really good stead for any interview process. So mandatory for someone to be in a lower socioeconomic status or eligible for free school meals. For this programme at the moment, yes. So must fulfil one of those two criteria. And as you go through the website, the free school meals within the last 6 years is pretty easy to understand. In terms of understanding whether you qualify through being having a main household earner, being from a lower socioeconomic status, there's more information about what qualifies for that on the website. If you're not sure, have a look, and if you're still not sure, apply. As long as you kind of feel you fall within that category and you've read from the website and you feel you qualify, apply, and it's something, and we can talk more about at interview. Can I check, is this also for current year 11 students who are about to start their GCSEs? So at the moment, the programme is only for students leaving year 13 or the equivalent, so people who will be 18 or older in September. We are definitely looking at the programme and how we can expand it, potentially offer opportunities to other people as well. But at the moment, the programme is just for people leaving year 13 or the equivalent. Where is the application linked on? So hopefully you'll be able to. Oh, Grace has shared that, which is fantastic. So that's straight through to the application. What is the age limit to be the maximum? So at the moment, the programme is targeted at school leavers. However, we have discussed in previous iterations around whether people leaving full-time education within 2 years is also something we would consider, and we've considered yes for this part. However, what we do want to do as we evolve the programme is make sure that we are considering how we can expand it and consider people from other backgrounds or other age groups or anything. So at the moment, this is focused for this year at school leavers or people who have left school within the last 2 years. Would we have to do an interview? Yes. So the second stage after application is an interview. So yes. However, we are aware through the program that you won't have had any experience of interviews. So we will provide lots of information about how to prepare, what to wear. And for this year, we even indicated what some of the questions are likely to be as well. So that's something that we are aware that you may not have had any interviews before. So that's something that we want to be able to provide as well. Is there an age minimum? So at the moment, the minimum age is 18. So with the being school leavers in September, then that's the minimum age. However, if for whatever reason you have potentially moved up a year, or there's a reason you're finishing year 13 but don't but are slightly younger, please let us know and get in contact. Because, as I say, this is more about the essence of providing opportunity for school leavers, not about a strict minimum and maximum age. It's around school leavers. So fantastic. Cindy has already applied, which is brilliant news. Another link from Grace. When is the start date? So the specific start dates are likely to vary slightly by region, but they will be sometime in September 2024. So they will likely be after the school holidays have finished in September 2024, because I know some of the school holidays drift into September, but they will be by the end of September. So that's that. Another question about age, which hopefully we've answered. How can I apply? Hopefully, Grace has shared the link to the application form within the chat. That's good. I'm going to be in year 13 in September. However, I'm 18 already. So a question about whether you can do the placement scheme and college at the same time. No, the job is a full-time job, so 37.5 hours a week. And so it is for people finishing year 13 and exiting full-time education. However, we will be opening applications for next year, hopefully around October time of 2024 for people starting in 2025. So absolutely keep your eye out. We will be opening more applications for the following year at the moment. And as I say, it's largely Monday to Friday 9 till 5 as a basis for what the hours will be. So that's hence why it's important that people have finished full-time education, because it's a full-time role. Lots of good questions. Would the interview be face-to-face or online? Again, this will likely vary by region. Most likely they would be face-to-face. However, through the process last year, we were flexible where we could be. So if people were abroad or there was a reason that they couldn't make the interview, we offered online as well. So most likely face-to-face. It will vary by region, but if there was a good reason why you couldn't make face-to-face, then we would encourage regions to offer online opportunities. Would you be entitled to annual leave during the placement like normal employees? Absolutely, yes. I spoke about how much I love my job and working in the NHS at the moment. So the annual leave entitlement is very good. So once you start in the NHS, your annual leave is 27 days plus bank holidays, and that's what you'll be entitled to. After 5 years, it goes up to 29 days plus bank holidays. And like me, once you've worked for longer than 10 years in the NHS, you have 33 days plus bank holidays, which is very, very generous. And I spoke about how much I love working in the NHS. I have a young family, and the generous amount of annual leave time off is a huge benefit for me, and allows me to spend valuable time with my young family. So yes, you'll be entitled to the same amount of annual leave as any other employee. That's 27 days plus bank holidays. How soon will we expect to be notified whether we've been accepted for an interview? So again, this will the shortlisting process will be run regionally, but interviews will need to be taking place in late June, early July. So I would expect you would hear within a month of the closing date, but I would expect you to hear sooner than that, but within a month. Um, what time we receive response? That's the same question again. That's helpful. So within a month, I would hope, a month the latest. How many will be accepted per the program per region? So at the moment, there's varying places per region. So we showed the slide earlier as to where placements are based. So in the Northwest, unfortunately, this year we only have one placement in Liverpool, whereas within the Midlands and and London, for example, we have more than 10 placements. So it varies. But 47 is the total number of placements that we have. And as I say, that varies by region between 1 and about 15 or so, I think we've got in the Midlands, which is great. Is it possible to get a chance to work with NHS after the work placement? Absolutely, yes. That is definitely the intention of the placement, is that not only do we provide a year's work experience, but the purpose of that year's work experience is to equip you to get a full-time job in the NHS after that. And I guess an ideal or a typical path might be that you do the 1 year placement, and you're in a perfect position to apply for an accountancy apprenticeship within the NHS, where you would then go on to study for your AAT qualification, and then on completion of that, you would then go on to study for your professional qualification, so CIMA or ACA or ACCA or SIPFA, which is the public sector version. And there are lots of different opportunities to do that on the job. So to have organisations pay for that, and for you to do it alongside a full-time job as well. As I say, you definitely don't need to have a degree in order to be a chartered and qualified accountant. And this is supposed to be the first step in the door in that journey to becoming a qualified accountant. But just to be clear as well, if you don't see that being your path, and actually you see your route into the NHS as not progressing in that way, and actually you're interested in perhaps more processy or transactional jobs, registering invoices on systems because you like that kind of closed environment and you like sitting in front of a computer and processing, that's okay too. This program is for those people as well. It's not just for those people who see themselves as future leaders. It's for both. So if NHS Finance is it interests you, but you're a bit intimidated by the word leadership or anything like that, that's no problem too. But definitely a substantive job within the NHS afterwards would be the aim. So yeah, that's great. So next year we will start. What are the benefits of working in the NHS? Really good question. So I spoke earlier about annual leave entitlement that's generous, that gives you time, paid time to do whatever it is that you would like to do in your annual leave. It's really, really interesting. That's the thing that drew me in the first instance, is rather than there's not many more interesting places than a hospital. I think, having worked with my mum as a healthcare assistant, they're massive, interesting, diverse places. Lots of different types of people work within a hospital. So you work with cleaners, porters, consultants, nurses, physiotherapists, HR professionals, operational managers, accountants, electricians, engineers. There's everything that you could think of within the NHS. So it's interesting. It also is for this is personal. For me, there couldn't be a better cause. So working difficult jobs, within the NHS, you're not working for someone else's profit or for someone else's money. You're working ultimately so that we can provide as best a healthcare service as possible for everyone. And I love that. It's the thing I love most about working for the NHS is the principle of equal access to healthcare, outstanding world-leading healthcare, whether you're a multi-millionaire or whether you're a homeless person. We're there for everyone, and for me, there couldn't be a better cause. And also as an accountant, sure, you can definitely go and earn more money working in the private sector, but the pay is competitive. If you progress, work hard, then there's a very, very comfortable life available because the salary is competitive with anywhere else. Loads of benefits. All I can say is that I love my job so much that it's motivated me to try and provide a similar opportunity for young people from a similar background as myself. If you have an AAT level 2 completed, do you have a level 3 available as an apprenticeship? So this is not an apprenticeship. It's a foot in the door. There are lots of different apprenticeships available within local organisations. There isn't a central apprenticeship programme for the NHS. There's a graduate scheme, and now there is the Insights placement. So you will need to look locally within your organisations, and the One NHS Finance website that Grace shared a link to is a great place to start to look at where you might be able to go for various opportunities. And if you have already through your college achieved certain levels, then I know that the apprenticeships will kind of fast track you on that journey and help you get your AAT quicker and move on quickly. Can you become a chief financial officer through this course and working your way up? 100% yes. That is the purpose, or part of the purpose of this program. I do have a degree, as I mentioned earlier. The degree that I have is absolutely worthless, considering what my job is day to day. I learned everything I needed to do within this role on the job and through my accountancy exams. I know lots of chief finance officers who have worked their way up from entry-level jobs as well. So I would say definitely yes, and I hope that some of the people on this call are going to help me prove it, and in 10 or 15 years be helping to support the programme as future chief finance officers as well. So I would say definitely yes. Do you need a vaccination to be an NHS employer? This will be a question for local HR departments because different policies vary within different organisations. And I think we are beyond the point of checking for all vaccinations now, but it's a local organisational policy. So you'll need to check with local organisations. But the requirement for that within office jobs like this will be far lower than in clinical jobs. What are the day-to-day things you will do if you do finance at the work placement scheme? So we touched on some of that earlier. So team meetings, working with other people within finance, meetings outside of finance with services, as well as work at a computer, particularly using programs like Excel to learn various skills of using data within Excel. That's a large part of most jobs within finance, especially in the NHS. Do you know any of the benefits you can receive with this placement? So hopefully we've given some of those benefits in terms of pay and annual leave. In terms of local benefits available within particular communities, they tend to be managed locally, but there are things like the blue light card, which give you various discounts at lots of different places. So, for example, 20% discount at Nando's, and there are lots of organisations that provide discounts to NHS staff, which you would be one when you start on this programme. Well, I think come to the end. What exactly would we do when interacting with different disciplines? For example, what would you do working with a physiotherapist involved? Really good question. So basically, lots of finance's job within the organisation is probably a fewfold. One, we have budgets. So every year we set budgets for every department. So, for example, you've used the physiotherapist example there. So our physiotherapy department will have a budget. They will have a certain number of staff that they are allowed to use, a non-paid budget for things like bandages, some money to replace equipment. And so they will have a set budget, and it's our job within finance to help them understand what is within that budget and to help them understand how they are doing with what they are actually spending against that budget. So that's kind of a first thing, is to help them understand and present to them, create the information monthly, but present to them information about what they're spending it on, and how that compares to their budget. It also might be to go a step further and work with them on some of the decisions they make that impact the amount of money they spend. So particularly, again, taking the physiotherapy as an example, it might be that different physiotherapists like bringing patients back into the hospital for lots of appointments, whereas actually it might be better for the patient and financially if some of those appointments can be done over the phone. If it's just a simple check-in and there's no need to do anything with whatever it is with the patient that's hurting or injured. So helping to consider how we might run services differently and run our physiotherapy department with some slots in work, because obviously you might need manipulation of a joint or something, but also to look at how we might be able to run our services differently, i.e. virtually, maybe via a Teams or via a phone call, that might work in a more cost-effective way, but also is better for the patient as well. If you've ever tried to park or go into a hospital, they're not always the easiest places to find parking, and especially if you're recovering from, say, a broken leg, actually leaving your house is quite a difficult job. So if there are things that can be done outside of the hospital, then that's brilliant. Can we work from home? Most jobs these days are a combination. Pretty much no jobs are entirely from home within finance departments. But likewise, pretty much no jobs are 5 days a week in the office as well. That said, certainly during the learnings, where you're learning something new, it might be most appropriate that you are in 5 days a week at times. But largely, most jobs now are hybrid, which is some days in the office, some days at home. So the department I work within largely have 3 days in the office and 2 days from home. However, there are some jobs like registering of invoices. If you're doing that and using scanners and equipment, it's quite difficult to do that from home. So varied is the answer. Each placement will vary, which Grace obviously helpfully answered in the question. What are the qualities of an individual? So as I said earlier in the start, the most important thing is that you show a desire to work in NHS finance. Why the NHS? What is it that draws you to the NHS? What is your kind of personal values that align to the NHS? Is it, for me, I've touched on mine. Mine is that making sure that every single person in the country has access to outstanding healthcare, whether you're rich or poor, is just a mission that I think could not be better. So I love going into work, ultimately trying to help achieve that. I don't think that your healthcare should be dependent on whether you can afford to pay for it. If you don't think that, or if you are against that, and then which lots of people are, then potentially working in the NHS might not be the place for you. So it's a desire to work in the NHS as well as an interest in finance. And whilst you don't need, we're saying you don't need to have a particular grade in maths or anything like that, an interest in how money works and finance within the NHS is all we're testing. Other than that, a desire to learn and to contribute to your local organisation. Would you say it's quite competitive to get a role in London? What can I do to increase my chances? So yes, I would say it's quite competitive. But if you're hardworking and committed enough, opportunities are there. What can you do to increase your chances? It's about having evidence to show your commitment. So maybe your local organisation might do some volunteering. You might be able to volunteer on the wards to get some experience of the NHS. Talk to relatives or friends who have relatives that work in the NHS. Anything you can do to build up your knowledge of the NHS or of your local organisations will increase your chances. And I say, getting some work or some volunteering experience is probably the best thing you can do to improve your chances. How many placements do you have in East London? Um, in fact, this is a question that just reminds me of something. It's probably worth us putting up the host. Grace, have we got the host organisations up on the website?
Yes, so I've just shared a link to
Oh, you've
a
got it
list
there.
of them all,
Perfect.
but you can actually download that list when you go on the application form. So the application form has an intro at the top of the page, and you can actually click on this link on that page to see what organizations are available. So you can actually see ones that are closest to you, closest to where you live or where you maybe want to be living at that time.
Lovely. Thank you very much. And thank you for all of the questions. Brilliant load of questions. As I say, this is the first year we're rolling the programme out nationally. My hope and plan for the programme is that you come into a job that is supportive, where you're able to contribute to your organisation straight away. And you're able to be provided with a supportive environment to help you learn everything that it takes to have a substantive job within finance within the NHS, and hopefully to go on and continue your career in finance in the NHS, which ultimately can lead to you becoming a chartered qualified accountant and hopefully chief finance officers of the future. If you're not sure, apply. What harm can it do to go through the process? You'll learn more through the interview process. And if you decide it's not for you, you'll have had an interview and got that experience. So good luck through the process. If you're looking for more information, there's the website. Have a look on LinkedIn, contact people from your local organisations within finance or your local regional finance academies. And I hope to see lots of you starting in September on the programme, which is very, very exciting. Thank you also for giving up your evenings and enjoy the rest of your evening that's left, and hopefully see some of you soon. See you later.